Hello, I'm Dr. Frances Pitzilis, and I'm here to talk to you about the serious problem of painful periods, or in medical terms, dysmenorrhea. Dysmenorrhea often accompanies menorrhagia or heavy periods, but not always. And it often, but not always, accompanies premenstrual syndrome and anxiety and other problems that women can have premenstrually. There can be primary and secondary dysmenorrhea, and primary is where no pelvic pathology has been found, but often this primary condition is still debilitating. And in my view, I have had many instances where this heavy, painful periods of no cause found responds to progesterone therapy, but you'll hear more of that in a moment. And then there's secondary dysmenorrhea, which can be from underlying problems. And these common underlying problems can include endometriosis, which is a combination condition of inflammatory and hormonal imbalances. Pelvic inflammatory disease, that's a condition where there's infection in the pelvic tissues. Adenomyosis is when there's endometriosis in the actual muscle lining of the uterus. Leiomyomata or fibroids can cause painful periods. An ectopic pregnancy. Interstitial cystitis, which is a bladder condition where the bladder is irritable, and I've often found that to go with irritable bowel. It's interesting, you often get painful periods along with irritable bowel, interstitial cystitis or irritable bladder, and then you often have associations with other chronic conditions like migraine and premenstrual syndrome and a chronic pelvic pain syndrome. The definition of dysmenorrhea or painful periods is painful spasmodic cramping in the lower abdomen. And when young women get this, it can start at adolescence or shortly after. How common is it? Well, the estimates are that between 45 and 95% of menstruating women get painful periods. With very severe painful periods, it's 10 to 25% of women in the reproductive age group. Now that is huge. And what are the risk factors to developing painful periods? Smoking, an early age when you start your periods, being overweight, alcohol, a family history of painful periods, your age gets worse as you get older, not having had children, any sort of psychological or other abuse, and stress. Even underweight women can get painful periods. This problem can improve with age, but not always. And we know that chemical messengers in the body called prostaglandins can be involved. And inflammatory messengers of other types as well can be involved. So it makes sense to consider underlying processes like diet, lifestyle, and correcting imbalance of anything that can reduce inflammation. In addition, there's a distorted hormonal environment in this condition, and it has been recognised that inadequate progesterone can be part of it. The mainstream treatment of dysmenorrhea when no cause is found, obviously when a cause is found you treat the cause, but if no cause is found, which is quite common, you give non-steroidal anti-inflammatory drugs, which I don't like because they're more likely to cause leaky gut or intestinal permeability. And stomach ulcers as well, and other side effects. The other alternative is to use the contraceptive pill, but that is not going to be useful if someone can't take the contraceptive pill or if they want to conceive. There is a role in painful periods or primary dysmenorrhea for progesterone, because it can come in very handy in women and works in the ones who wish to conceive and can't have the contraceptive pill and have painful periods. In fact, it's thought that progesterone reduces the prostaglandin messengers that cause the pain in the first place, and another mechanism by which progesterone works is probably by reducing inflammation. My own experience is that it's always worked. So I believe that apart from non-steroidal anti-inflammatory drugs and the contraceptive pill, serious consideration should be given to natural or micronized progesterone, not synthetic progestins, the natural one, to be used in the second half of the cycle to stabilize the lining of the uterus and reduce painful periods.